morning. My name is Victor Higgs. I'm the Managing Director of Applied Nanodetectors, and our objective is to change and transform the way that respiratory disease is managed to a more preventative and personalized solution. And this will not only help improve patient outcomes, but it will stop people going in to hospital. About 30% of hospital admissions are associated with diseases like asthma and COPD. So here's an outline of my talk. I'm just going to give you a bit of background to the challenges around managing self-management of respiratory diseases like asthma and COPD, and talk about our solutions and give you an insight into how these can be utilized to help improve the patient outcomes, but improve their quality of life. So one of the current challenges that most healthcare systems face is the fact we're all living longer, and many of us, as we get older, suffer from a long-term condition. 80% of healthcare costs are associated with the management and diagnosis of chronic conditions such as asthma, cardiovascular disease. And you can see there's a significant burden on hospitals, not only in terms of resources, but also the significant budget. So what can be done and what can be helped to help patients more effectively manage their chronic conditions? So there's a number of different solutions, and in this show there will be some discussions about integrated care solutions. But my main focus today is to look at the different ways that you could utilize remote monitoring and self-management. And I think this is key, that many conditions can be managed in the home, but it's educating and empowering people, giving them the tools and utilizing technology to predict and prevent exacerbations and give them a pathway and advice and support to help them manage their condition. So the burden of respiratory disease across Europe is quite significant, as you can see from this slide here. And I think one of the significant factors is the number of hospital admissions that are associated with respiratory disease. And as I mentioned at the beginning, within the first month or 3 months of discharge, about 30% of patients are actually readmitted. And as you can imagine, many patients that are discharged, there's no way of monitoring or even identifying patients that are at risk of deterioration of having to be readmitted to hospital. Another challenge, unfortunately, associated with COPD and asthma is, unfortunately, the patient outcomes associated with the mortality and quality of life, unfortunately, is very poor in the UK. And you can see from this slide that there's a significant number of deaths, and mortality is quite significant with COPD. In fact, in the UK, there's approximately about 3 million people undiagnosed with COPD. Secondly, there's no objective testing for asthma, and there's a cross-interference of the two diseases, and it's not easy to identify patients that have respiratory conditions. And then, of course, give them the appropriate treatment. But once they're diagnosed, you can imagine during reviews, especially asthma reviews, which take a short period of time, we have no understanding what's happening with their condition throughout that period of a year when they've had one review. So clearly, the support of remote monitoring and information about that patient throughout the year would add much more value to actually better enabling the support and self-management of these patients. Another consideration that we underestimate is the effect of air pollution. And from surveys through charities such as Asthma UK, about 70 to 80% of people are affected by air pollution. And also, our lives have changed in the last few years. We're actually spending more time in the home. We spend about 90% of our time indoors. Unfortunately, in the home, there are a lot of indoor air pollutants associated with cooking and cleaning that can aggravate people with respiratory conditions. And this is quite important, especially for young children, when they're getting exposure to chemicals and various considerations in the home that can aggravate and also lead to the sensitization of the airways and actually lead to them having asthma. So there's a significant challenge for respiratory patients to be managed in the home. And it's important to understand not only the air pollution in the home, but also external air pollution that can diffuse into the home, especially if they live close to motorways. So we have developed two solutions, a point-of-care test that uses nanotechnology, and that's where the nanotechnology comes in. And this is detecting markers of disease on the breath. These are very trace levels of, there are about 200 diseases that you can diagnose from breath testing. And what we've done uniquely is we standardized the collection of the breath using an end-tidal collection. That means when you exhale, we're only collecting biomarkers at the full exhalation. The other thing that we do is we collect 30 parameters from the breath. All this information from the sensors is analyzed using an artificial intelligence algorithm that generates a clinical risk score. And what this does, it can actually, for asthma, we can actually predict exacerbations 5 days ahead. So this is an amazing window of opportunity to stop and empower patients to take action to minimize the effect of having an asthma attack and stop them going to hospital. The second thing that we've been working on is Air Elusive, which is an indoor air quality monitor. So if you're having any self-management in the home, it's important to understand if there are any triggers in the home. But more fundamentally, it's helping asthmatics identify what those triggers are and help them eliminate them, and therefore improving their quality of life. It's no good having patients at home if you're not thinking about the environment that they're in, especially for people suffering from COPD and asthma. So as I said, our objective is to develop a point-of-care platform that can be used in the home to not only self-manage patients, but to link this to their action plan, which is on their mobile phone, to give them a more effective way to manage their condition. But it's empowering them, giving them education and support, which can be linked from the data collected on the device through community nurses and back into the health management system to help those patients be easily identified if there is a risk of deterioration and help them, support them through education and utilizing these technologies. So the breath analysis, I'm not sure if you're all aware of this, but there are breath testing now available through the NHS to predict a subtype of asthma, eosinophilic asthmatics, which are about 50% of all asthmatics, which is routinely used. So there's real value in breath analysis because it's a non-invasive test, it's easy to use for children and adults, and it's very easily to be utilized in a GP setting. What's different with our approach is our breath test can be utilized for every subtype of asthma. It can also be used for all ages, from children to adults, and it can be used for many different chronic respiratory diseases, including COPD and cystic fibrosis. And it's all about using breath analysis to predict these exacerbations in advance and help the patients manage that and minimize the times that their asthma is out of control. So here's a short video of the breath testing. So as your body changes through metabolic changes or changes when you become ill, these generate biomarkers which are circulating in the body. What we're interested in are the volatile biomarkers that are emitted through your breath, which you can collect through this point-of-care device. And inside that device, we're using nanosensors to detect these very low levels of chemicals accurately and more sensitive than other technologies. We combine that with 30 other parameters from the breath. That's fed into an AI model to generate these clinical risk scores. Okay? And what we do differently with our device, we actually use a deep neural network. So as the patient utilizes and uses this test on a daily basis, it personalizes it to the user. It optimizes the levels to understand what's appropriate when that person's asthma is well controlled or COPD. So the key things here is prevention, personalization, and predicting these exacerbations. So as I said before, the real value here is to help people more effectively manage this condition in the home setting And utilizing the air quality device, this can help them identify triggers that trigger their COPD or asthma exacerbations. And as I said to you before, we've been working on the clinical validation of our Excel platform, and we've showed there's a window of opportunity of 5 days, which is incredible. This means that you can transform the way that respiratory disease is managed to a more preventative and more personalized solution to help the patients improve their quality of life, but empower them, give them the options to think about what can be done to minimize the effect of exacerbations on their life. So here's a high-level view. So our approach is that during the exhalation, we use end-tidal collection. So this is a standardized method of collecting the breath biomarkers. We collect also the carbon dioxide waveform. So as you exhale, there's a change in the CO2 waveform, and this actually was utilized in the 1990s by ambulance drivers when people used to present themselves breathlessness. They weren't sure if they're having an asthma attack or a heart attack. So the combination of VOC biomarkers, the carbon dioxide waveform, and other parameters in the breath are all fed in to this AI model to generate a clinical risk score, and we've collected over 3,000 data points. And we can also utilize a big data approach and combining this information with air quality and hospital readmissions to improve the accuracy of the prediction. So here you see it's quite simple. It's a point-of-care test with a disposable viral bacterial mouth filter, which is COVID safe. It's end-tidal. It's not forced exhalation like spirometry. It's linked to a mobile app. You simply breathe into the device. It's a 4-second test, and that clinical risk score is fed into the mobile app. And then the patient has a traffic light system. Green, everything's fine. You don't need to do anything. Your asthma's fine. A score of 2 means your asthma is quite poorly controlled. You need to check your asthma action plan or your COPD action plan. And a score of 3, you need to contact your respiratory or your community nurse as soon as possible. So here's a short video showing you how easy the test is to carry out.
First, switch on the device. Remember to always use a mouthpiece. Press the Start button to begin. Before testing, you must answer 5 questions on the app about your asthma control. Exhale into the device slowly and control your breath flow for 4 seconds by trying to keep the marker between the 2 red margins. When the test is completed, your results will be shown on the mobile app.
So again, here's a high-level view. As you exhale into the device, that information is saved and encrypted on the microcontroller. The other thing that we do is we use embedded AI. And what embedded AI means is the algorithm is actually on the microcontroller. So as you exhale, all the information for the sensors is analyzed on the microcontroller in real time. You don't need internet connection at this time. It's all on the device. You get an instant result in 4 seconds. If there's no internet available, which sometimes happens in homes around the UK, when the internet comes back on, that information then is sent to the cloud, encrypted and saved. This data can be accessible through the health management system or through the community systems. And also we use a big data approach where we collect information, especially about air quality in the local area where they are. It gives them alerts. And that's all fed into this algorithm that can be updated on the device to improve the accuracy, but also it's identifying patients at a risk of deterioration in advance to help more effectively manage these conditions. So here's a summary of our indoor air quality device, and what's unique about this device are 3 things. The first thing that we've done is that we're using AR to visualize the invisible pollutants. We're all in this room, we're not sure what we're inhaling. So imagine in the home environment, we're not sure that what we're being exposed to are our children. The AR app superposition of these pollutants in your home, by touching on the mobile app, you can identify the source of these pollutants, whether it's cooking or cleaning, and this helps then the user to link into their asthma trigger log, which can then help them identify what could be upsetting their asthma or their COPD. This is all done automatically. We use an AI model on the device collecting air pollutants and giving a notification through the mobile phone of alerting users of pollution spikes. So have you been cleaning today? And the simple action can be just open your window. Have you been cooking today? Put your ventilation on. And it helps people identify what these triggers are and minimize their exacerbations. So I hope I've shown you today that utilizing our preventive approach, early interventions are life-saving. It's stopping people having these exacerbations, and it's identifying patients that are at risk of deterioration very early so an action can be put in place to help manage their condition more effectively. So I hope you enjoyed the presentation. Our stands at the back here. We're happy to give anyone a live demonstration, and thanks for your time.